A hearty good afternoon and welcome to the session of Fertility and Fitness. We are glad to have Dr. Aruna among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Hello everyone, this is Dr. Aruna from Apollo Fertility RR Nagar. Today I would like to tell you about the fertility and fitness. So before starting with fertility and fitness, we will just understand what is obesity as such. As we know, obesity would be like 40% of the world population are facing with the word obese. So how do we measure the obesity? So usually it is measured in the form of body mass index. So how do we calculate body mass index is basically weight in kgs by square root of height in meter square. So the normal body mass index would be somewhere around 18 to 25. Those who are less than 18 are lean and more than 25 would be obese and more than 30 would be overweight. More than 25 would be overweight and more than 30 would be obese. So obesity is one of the most risk factor for ovulation. I mean, there won't be any ovulation those females who are being obese, and they need more medications when they start with the treatment. So there are like how do the obesity affect both female and the male fertility would be. So as we know, in obese there would be more excessive fat which have been deposited around the belly and upper part of the thigh and the buttocks. So there will be more chances of insulin resistance. So the insulin would behave something like estrogen and it would prevent the exogenous estrogen production in the body, endogenous estrogen production in the body. So there would be a something called insulin resistance. So the female would be going through like hypoglycemic status, like they are more prone for diabetes, and there are increase in the estrogen, which in turn results in increase in androgen as well. So they would not be able to responding to the estrogen, and in spite of being high amount of estrogen, so they are more prone for non-ovulatory cycles and thickened endometrium, which would result in non-implantation and all that. And in the male, as such, the obesity would result in the deposition which is around the belly would make them like more like acts like a physical barrier for sexual intercourse. And when we do a semen analysis, there would be a low sperm count and as well the motility. So the obesity, in spite of being a lifestyle disease, it's also because of the stress induced and because of the sedentary lifestyle what we have been going through now. And we're coming to the topic today that's called fitness and fertility. So how fit we should be before we start the fertility treatment as such, and what would be the weight we should shed off before we start the treatment. See, normally the we say around 10% of the body weight at least should be tried to shed off before we start the infertility treatment. So what is like BMI of more than 35 would having two times more they would be requiring two times more the medications to start, I mean, to conceive. And those who are less than 19 will take at least four times lesser times to try to conceive. So 20 to 30 BMI would be okay to continue the treatment. So, and then what are the exercises? We usually say like we should never concentrate on doing a high intensity exercises like maybe cardio exercises, and those like where the heart rate increases and there will be a severe exhaustion or panting and all that. Because I mean, those who are whenever there is an increased BMI, increased body metabolic rate, there are chances of endorphin release, and then the reduction of fertility can take place. So we always tell them to do a moderate types of exercises. That could be slow walking, or could be yoga, or could be a running, maybe even a moderate cycling also should be fine. And how often you are supposed to do exercises, like daily exercises would be always preferable, at least 10 to 15 minutes in a day, which you could keep it for an exercise. Or probably if you do it in a week, probably three times a week would be ideal to do. And I mean, there are certain myths that okay, if you do exercises there are chances of abortions, and they can be related with miscarriages and congenital anomalies. That is absolutely wrong. Okay, so doing an exercise is even before conception and even after conception would not result in any of the complications happening during pregnancies. And in fact, doing an exercise would result in weight control, and also will make you more you respond to the medicines very early. So, as I told you, at least 10% reduction in the body weight is an ideal weight to start with the treatment, and even with both male and the female. So, exercises are different for a different body structures, so it will be ideal to always to consult a fitness specialist or a dietitian, so that you frame your structure of exercises and then do it. It's not like you just go through an app and just do it as such. It should be always a framed sort of exercises, or probably you put up a program and you follow that program, and it should be both with the nutrition as well as with the exercises. And it should be a continuous process. It's not like doing today and then you take an off for a week or something like that. So it should be continuous. And one more thing is doing exercises during the treatment. See, especially during the stimulation, what do we do when we stimulate? There are the eggs which gets up, which are increased during the ovaries, make the ovary more bulky. So we ideally tell them not to maybe not to have much more strenuous exercises during the stimulation, as basically because the ovary being bulky have a chances of torsion. So especially during an IVF treatment or even an IUI treatment, we tell them not to have any exercises at the time of conceptions. Like once they conceive, like after the 10 or 12 weeks, we tell them to start with the slow exercises. So that is what is about like having the exercises during and after IVF treatment. So, and the exercises should always be of a moderate intensity. Yoga is a very good exercises to start with. So there are so many asanas which could be used only for the particularly to increase the blood supply to the pelvis and the lower part of the body. So both for the female and the male. So it would be ideal to get on to a yoga therapist and start with the exercises. And always it would be better to be fit enough to start the treatment rather than going back and once a failure happens and then again going back. And the always the body mass is make a lot of differences when we start the treatment, because you would require more dosage of injections, and moreover the quality is also compromised with you being obese. So I would end up the session with this. So kindly have a healthy practices before you start the treatment. Thank you.